In order to enjoy life to the fullest, we need to identify and treat disease at its earliest stage. Unfortunately, in today's modern world, we're not doing a good enough job. We're using screening tests like Lifeline screening and cardiac stress tests to help you determine if you have disease, and this just isn't good enough. If you have an abnormality on your Lifeline test, you really do need a Lifeline. The Lifeline tests involve 3 tests. One is an ultrasound, a carotid ultrasound through an artery in your neck to see if there's any blockages. Another is what's called an ankle brachial index. It measures the blood pressure in your ankle and in your arm to see if there's a difference. And the aortic aneurysm screen of the Lifeline screen looks to see if there's a bubble, a weakening of the lining of your aorta before it ruptures. If any one of these diseases is abnormal, you're way down the path towards disease. Cardiac stress test is a really good example. Most people think of that as a screening test for heart disease. Unfortunately, in order for your stress test to be abnormal, you need to have a 70% blockage of one of your arteries in your heart. People may remember Tim Russert, the ABC anchorman, who had a normal stress test in April of 2008. He proceeded to die of a heart attack in June of 2008, just 6 weeks later. It wasn't good enough for him. 86% of heart attacks occur in people who would have a normal stress test. Half the people who die of a heart attack, it's their first symptom ever of heart disease. This testing just isn't good enough. So with our health mapping approach, we're able to use 21st century technology that will identify disease much earlier than that. We look at several things. We look at the carotid IMT ultrasound. That's very different than the carotid ultrasound you get in a Lifeline screening. With this test, it actually takes a very high resolution ultrasound probe and measures the thickness of the wall of your neck and identifies if there's any risk, any plaques that are vulnerable, ready to pop, like a blister. That's different than the Lifeline screening, which just watches the flow. We also can do coronary calcium scoring. That's looking for calcium in the artery of your heart. Not quite as good as the IMT ultrasound, but good to identify the heart because you can't do that same test in the heart. We look for evidence of what we call oxidative stress. That's to look to see if you're rusting. We use a simple urine test. Use a simple scanner to identify if you are rusting. And then we do things like looking for heart strain. A simple blood test can look to see if your heart is under a little bit of strain that you don't feel. And then we look at reasons why, such as sleep apnea, any thickening of the heart, high blood pressure that may be affecting your heart. We look for that. And last, but certainly not least, is we look at a fire panel. That's looking for inflammation. We now know, as of the last couple years, that inflammation is the cause of heart attacks and the cause of strokes. It's not cholesterol, it's not blood pressure, those are important factors, but the cause is inflammation. And there are several very good, scientifically sound inflammatory markers that are significantly underutilized in modern medicine that we can identify whether your vessels are on fire. So that once we identify what's happening, that we measure for disease, the next step is assessing the root causes of disease.